Hello and welcome. Today we're diving into a rare and complex topic, urethral metastases. We'll explore what this condition entails, its causes, how it develops, and what can be done about it. Understanding this condition is crucial for both medical professionals and anyone seeking to broaden their knowledge of urological health. Urethral metastases occur when cancer cells from a primary tumor located elsewhere in the body spread to the urethra. Unlike primary urethral cancer, which originates in the urethra itself, urethral metastases are secondary tumors. Common primary sites that can metastasize to the urethra include cancers of the prostate, bladder, kidney, colon, rectum, and less frequently, cancers of the lung, breast, and skin. The spread can occur through several routes, including direct extension from adjacent organs, lymphatic spread through the lymphatic system, or hematogenous spread via the bloodstream. The pathophysiology of urethral metastases begins with the detachment of cancer cells from the primary tumor. These cells then travel through the bloodstream or lymphatic system. Once they reach the urethra, they adhere to the urethral lining and begin to proliferate, forming a secondary tumor. This proliferation can disrupt the normal function of the urethra, leading to obstruction, bleeding, and other urinary symptoms. The specific mechanisms that facilitate the adhesion and growth of metastatic cells in the urethra are complex and involve interactions between the cancer cells and the urethral microenvironment. Urethral metastases are considered a rare condition. Due to their infrequent occurrence, precise epidemiological data is limited. However, studies suggest that urethral metastases are more common in men than women, likely due to the proximity of the prostate and rectum to the urethra. The true incidence may be underestimated, as urethral metastases can be asymptomatic or mistaken for other urological conditions. Further research is needed to fully understand the prevalence and risk factors associated with this condition. The signs and symptoms of urethral metastases can vary depending on the size and location of the secondary tumor. Common symptoms include hematuria or blood in the urine, urethral obstruction, which can lead to difficulty urinating, weak urine stream, or urinary retention, urethral pain or discomfort, and palpable mass or swelling in the perineal area. In some cases, patients may also experience urinary frequency, urgency, or incontinence. It's important to note that these symptoms can also be associated with other urological conditions, making accurate diagnosis crucial. Diagnosing urethral metastases typically involves a combination of clinical evaluation, imaging studies, and tissue biopsy. The diagnostic process usually begins with a thorough medical history and physical examination. Imaging studies such as cystoscopy, erythrography, CT scans, MRI, and PET scans can help visualize the urethra and identify any abnormalities. However, definitive diagnosis requires a biopsy of the urethral lesion, followed by pathological examination to confirm the presence of metastatic cancer cells and determine their origin. Urethral metastases are generally not classified into distinct types in the same way as primary urethral cancers. Instead, they are categorized based on the primary cancer from which they originated. For example, one might encounter urethral metastases from prostate cancer or urethral metastases from colon cancer. This distinction is crucial for guiding treatment decisions, as the management approach is often tailored to the specific type of primary cancer. The treatment and management of urethral metastases depend on several factors, including the primary cancer type, the extent of metastasis, and the patient's overall health. Treatment options may include surgical resection to remove the metastatic tumor, radiation therapy to target and destroy cancer cells, chemotherapy to kill cancer cells throughout the body, and targeted therapies that specifically attack cancer cells based on their genetic makeup. In some cases, immunotherapy may also be considered. The treatment approach is often multidisciplinary, involving urologists, oncologists, and radiation oncologists working together to develop a personalized treatment plan. Currently, there are no specific preventative measures specifically for urethral metastases. However, early detection and treatment of primary cancers can reduce the risk of metastasis to any site, including the urethra. Regular cancer screenings, such as prostate-specific antigens at PSA testing for prostate cancer and colonoscopies for colorectal cancer, are important for early detection. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding tobacco use, can also contribute to overall cancer prevention. The prognosis for patients with urethral metastases is generally guarded, as it often indicates advanced cancer. However, the prognosis can vary depending on the primary cancer type, the extent of metastasis, and the patient's response to treatment. Recent research is focused on developing more effective targeted therapies and immunotherapies for advanced cancers, which may improve outcomes for patients with urethral metastases. Ongoing clinical trials are exploring new treatment strategies and seeking to better understand the mechanisms of metastasis, ultimately aiming to improve the survival and quality of life for affected individuals. Thank you for joining us today in exploring this complex condition.